If your shoulders, arms, and hands get nervy pain anytime you use them, and the exercises your doctors gave you aren't working, then here's what you need to do. My name's Adam, and being a sports massage therapist, I have found several ways to get rid of nervy pain instantly, with the first method being to release the scalenes. These muscles are located on the side of the neck, and as you can see, there are nerves and blood vessels that go through them, which means if these muscles end up getting tight, they can actually end up compressing on the nerves and blood vessels, creating your shoulder pain, arm pain, and even hand pain. And the way it does this is because when you use your muscles every single day, those muscles are going to end up shortening. And every time it's shortened, it's going to end up compressing on those nerves and blood vessels. And sadly, this is really unavoidable because it's all thanks to our day-to-day lives, like our posture and our work. Because, for example, if you have something like forward head posture or working on a computer, then there's a good chance your head is going to be pushed forward a little bit, which means these muscles are going to be contracted. So if they're contracted, that means those muscles are going to shorten. And when they shorten, they're going to end up creating that compression. So you can imagine after years and years and years of doing this, it finally has caught up to the point where regardless of how you position your body now, or regardless of what kind of exercises your doctor gives you, muscles, those scalene muscles are going to remain nice and tight, and they're going to keep compressing on the nerves and blood vessels. And to be clear, there's actually a lot more muscles that can create the same kind of pain. For example, you have the pec minor, which is a small muscle located within the chest in the upper portion, which can also create some kind of compression on your nerves and blood vessels. Or you have the subclavius, which actually attaches to the clavicle and the first rib, which means, again, if it gets tight and shortens, it's going to pull those ribs together, which then creates some kind of compression on your nerves and blood vessels. This is known as the first rib compression here. We also have the deeper coracobrachialis, which is a deep bicep muscle, technically a shoulder muscle located inside the bicep. And again, nerves and blood vessels go right behind this muscle, and if you constantly using your arms every single day, these muscles are going to contract. And when they contract every single day, they're going to end up compressing on those nerves and blood vessels if you're not doing anything about it. Now, besides tight muscles, there's other reasons that you may end up feeling nervy pain in the shoulder, arm, or even hand. And that other reason is trigger points. A trigger point is essentially a small little area within the muscle that is basically locked in a shortened position. It remains in that position. So anytime you are stretching that muscle or you lengthen it basically by just moving around, that little portion in that muscle remains in a short position, remains in a locked position. And because of that, it can actually compress on the nerves and blood vessels that go around it, but it can also pull on what's called the fascia system, which is the actual connective tissue that wraps around the muscle and goes through it. And this is important because your fascia system not only wraps around and goes through the muscles, but it goes from one muscle to another, creating this chain-like effect, which means if you pull on one side, you're going to be able to feel it on the other side. So now you have this trigger point that's locking one muscle short and tight. So anytime that muscle has to move or lengthen, it's going to pull on the rest of that fascia body, on the fascia line here, which results in some kind of tension, pain, or in this case, nervy-like sensations. You see, trigger point pain feels like nervy pain, but if you actually stick with it, if you try to release it for about 2 to 3 minutes, we'll say, then that muscle, that trigger point will actually begin to dissipate and that pain will begin to go away. You just got to pay attention to it and you got to give it a chance to release. Now, some of those trigger points that can be found is going to be in the pec major or the latissimus dorsi. Both of those are common areas where trigger points can create referral pain that feels like thoracic outlet syndrome, that feels like carpal tunnel syndrome, that basically feels like nervy pain. I've also seen some trigger points within the rotator cuff muscles as well, like the infraspinatus or even the subscapularis, where these muscles as well can house trigger points which may not directly shoot down the arm, but can create that referral pain in that area, which then makes it feel like nervy pain because it feels pretty much the same. Now, if you actually want to learn how to release these trigger points and even the scalings, make sure to check out the video popping up in the top corner. If you're just ready to knock this pain out in a few days, and make sure to check out my programs over at trainingmassage.com, specifically made for this nervy kind of pain.